Getting ready. Ready, set, go. Yep. Good evening, everyone. Welcome to Medical Mondays with Dr. O. I'm Dr. Toyin Okwesomi, a family practitioner, HIV specialist, and I treat addictions in the state of Maryland. I enjoy what we do weekly, sharing medical knowledge, medical information to better our health and to, just prosper us health-wise. We've been blessed with amazing speakers, with experts in different fields who have been on this program and have, just imparted into us. Tonight, we have another amazing speaker, Dr. Kehinde Elisha, who is a DNP, and she has a slew of other, accolades that I will let her introduce herself better before she, starts her talk. She's the founder of NP Certification Academy, an academy that certifies nurse practitioners in all specialties. She also founded Kehinde Elisha's Learning Institute with more than 3,500 followers on Facebook and 14,000 followers on LinkedIn. She's a speaker, coach, and professor at Ultimate Nursing School. So tonight, she'll be looking into personality disorders and its effect on relationships. We take a lot for granted when it comes to personalities. In fact, I think everybody has something mental health-wise. If you pay attention enough, you will see that you do have something. And that's the purpose of our delving into this topic tonight. She will dive into 10 types of personalities and how to recognize them. So, Dr. Elisha, the floor is yours. Welcome.
Thank you so much, Dr. O. I really appreciate the introduction. And thanks so much for having me. It's my pleasure being here tonight. Definitely, I love what I do and I love people too. So my love for people has helped me dive into personalities and how it really affects us. And some of the questions that really bothers me is, how do we come together as a family, as friends, and now it just turns sour. What exactly is the root cause of this? A lot of people in relationships, they have read books in efforts to rectify the differences in their relationship, whatever that relationship is, mother to child relationship, father to child relationship, husband to wife relationship, cousins relationship, whatever relationship it is. Why are we still not meeting in the right point? So when I look at books on relationships, I feel like something is missing in most of them. Science has not been integrated in most of the books. And that's why I'm here tonight, to shed more light that, hey, there is, maybe there's a path here. I don't know. It depends on your beliefs too. It depends on how you see life, and it depends on how you see the content that I'm about to present right now. Speaking here is Dr. Kehinde Elisha, founder of NP Certification Academy. And of course, I look forward to, being an author in future. I am not yet. But at this time, though, I'm going to focus on personalities. I will teach the content or shed more light on the content so we can better understand it. And also, I will bring it to life or give some scenarios to help us relate better with the content. And before I go deeper, like she said, that, hey, most of us probably have something. As we go through this content, don't only diagnose your neighbor, also diagnose yourself. Whenever you see anything that looks like you, smells like you, sounds like you, maybe it is you. And maybe it is time for us to start picking up on those pathologies and start adjusting them, or start looking for ways way forward, I would say. Start looking for ways to improve ourselves and ultimately our relationships. It's time to stop making excuses, and it's time to it's time to put that ego aside that, oh, we are perfect, because nobody is. So now, when we talk about personalities, even our celebrities are not exempted. Look at this guy, what's his name? Kanye West. He's been all over the news. We all know what's up with that. Of course, I'm not going to get into him because we know about him today, but in summary, he has bipolar. So why are people not looking and seeing the bipolar in him? Some of his irrational behaviors, some of his grandiosities. Why are they not seeing it? They're not seeing it because they don't understand it. And that's why I'm also here to teach and create more awareness that, hey, psychopathologies do exist and we believe in it. You have to see it, you have to know it, you have to understand it to believe it. All right. So today, the first thing I'm going to talk about here is cluster A. What do we have under cluster A? And don't get me wrong, we have all kinds of personalities out there. Different people group it differently. The ones that we actually recognize in the medical world, or the one that we actually treat within the medical arena, is these types of personalities right here. We also have the Myers-Briggs personality test and so many other personalities. We're not going to talk about those tonight because really, there is really no scientific evidence to back those up. However, I would say Myers-Briggs is probably the next closest thing to this one. Myers-Briggs is also good, but we must think about medical aspect first. So this is purely medical. I am not going to connect with any kind of religion. There is a God component to things too, but we're focusing strictly on medicine tonight. So cluster A, what is it about? It's paranoid, schizoid, schizotypal. That means we have these types of personalities under cluster A. So who is a paranoid person? What do they look like? They can be very distrusting. They can be very, very suspicious. They interpret every little move you make and give it a serious meaning. You know what I mean? Like if they see you putting on a ring, they might think you have some kind of voodoo or something. They will give a meaning to every little thing. Schizoid, what about those ones? They can be detached. They don't know how to socialize. They don't know how to mingle with people. They have restricted emotional expression. They are the ones that you will see at work. You'll be like, why are you so unfriendly? No, they are not being unfriendly. They just don't know how because they are altered. But to them too, though they are perfect, to every individual feels perfect in their own mind. Let's keep that in mind. What about schizotypal? Schizotypal, they have this social discomfort, cognitive distortions, behavioral eccentricities. So what do we mean by that? So a schizotypal is somebody that will put on a chain, a necklace, and say, oh, this necklace can save me. Don't get me wrong. I'm not attaching it to religion. It is different if that person belongs to a particular religion and they believe that, oh, that pendant or that necklace that they have on their around them is going to save them. That's different. Let's talk about cluster B. Cluster B is antisocial. How do they behave? Antisocial, they have disregard for and violation of rights of others. And look, many people misuse this word, antisocial, and they don't even, that's because of lack of understanding. If you tell me, if I'm walking on the street and say, oh, look at that guy right there, he's so antisocial, I'll probably run the opposite side because I would think they have a gun. An antisocial person is not the way we say it literally. It means a lot more than that. So it is a disregard for and violation of rights of others. They are the ones that we end up in jail. They are the ones that will rape people. They will go out and shoot people. And as a matter of fact, something leads to antisocial, and that will be a different topic for a different day. When we are raising our kid, if our kid becomes really oppositionally, if they are so defiant, they don't listen to us, they're not trying to do whatever we're saying, they ignore authority in school or at home or wherever, we have to understand, we have to know that, it is a conduct, I mean, it's an ODD for that age, and we have to prevent that from progressing to conduct. Conduct as a child will be what is going to progress to antisocial. Antisocial as an adult is a little bit too late to reverse, except, you know, some other interventions are taken. Now, what about borderline? Borderline, they are in unstable relationships. They are, you know, self-image is a big deal to them. They are very, very impulsive. And you will see more images of these people to have it, you know, to have a better understanding or a better grasp of what I'm talking about right now. This is not something that you can understand in just 15 to 20 minutes, but at least you know it's out there, and then you know you're going to know to dive in better when you're free. What about histrionic? Histrionic, people like, oh, she held the door for me. Oh, she's in love with me. Oh, she told me bye-bye, and that means she's in love with me or something. Like they give meaning to everything you do to them, and they exaggerate relationship, or they take it to a level where you don't mean to take it to. What about the narcissist? Narcissistic. Somebody with a narcissism or a narcissistic personality is a different level entirely. Who are they? They have this grandiose thought of themselves. They have need for admiration. And that is what kills me. That blows my mind. How can you be so mean to somebody and you still want them to embrace you and caress you and kiss you on the cheek? Are you kidding me? When you are mean to people, most likely you will get a pushback too. They will leave you and distance you and leave you where you belong. Let's talk about cluster C. So cluster C is avoidant. They are socially inhibited, feelings of inadequacy, hypersensitivity to negative evaluation. What about dependent? Submissive behavior needs to be taken care of. So dependence just means what? They just fully depend on people. They don't if I usually give my country as an example in class, I'll be like, okay, somebody calls you from Africa. On Monday, they need money for diapers. On Tuesday, they need money for drugs. And on Wednesday, they need money for school fees. And on Friday, they need money for food. And you're like, are you kidding me? Now, it's different. We all depend on people in some form or shape. But I mean, constant dependency becomes a real problem and a real burden to the bearer. Now, what about obsessive compulsive disorder, personality disorder? There are two types of compulsions. We have obsessive compulsive personality disorder, and we have obsessive compulsive disorder. Look, obsessive compulsive personality disorder, they are egocentric. They believe that the way they are is just perfect, and no one beats their personality. And in fact, they want to recruit you to start behaving the way they do too. Now, obsessive compulsive disorder, on the other hand, they know they have a problem and they are willing to seek care. There are two different types of people, so don't let us mix it up. A personality and the psychopathology is a different side of, it's a different one entirely, which we are not going to get into right now. At this time, we're going to dive into some images. So let's talk about cluster A again. I told you exactly what they're going to look like. I remember I told you we have three clusters. Don't forget, cluster A, cluster B, and cluster C. So when we talk about cluster A, what is the summary of cluster A? They are the ones that are very hard. They are very eccentric. Okay, look, that is the paranoid. You see how paranoid he is? Schizoid personality. This one keeps to herself. Okay, imagine you work in a place where they don't like you. Do you imagine yourself recruiting some schizoid personality and keeping to yourself too? So now, when does it become a psychopathology? It becomes a psychopathology when you remain like this for like a full year or for 3 years. You know what I mean? When you are just like this. But then in your 12-hour or 10-hour shift, for example, you notice that they were so unfriendly to you, maybe for some reason, and you decided to isolate yourself too, just to keep, stay away from whatever trouble that they are causing on the job, just for your shift. That does not make you a schizoid personality. So all these personalities too, they have other criteria that must be met before you can call it what it is. And that's what I tell people. I say, you know what? Don't start looking at your neighbors and don't start thinking about your coworker that maybe they have this or they have that. There are a lot more things to look at. Do they sit in it? Are they always like this? And then they have schizoid. And schizoid, they like to be like that. They like to be loners. They rather be like this. It is different from avoidant. Avoidant and schizoid are very similar personalities. The only difference is that avoidant, they like to be around people, but they are very scared somebody's going to embarrass them, that somebody's going to insult them. For that reason, they isolate. And those are the people I say, okay, if you think, your ego will not accept a little bit of insult once in a while, then maybe you shouldn't marry, or maybe you shouldn't have friends, or maybe you shouldn't work, because it's going to happen. We are human beings. Don't isolate people because of some insult or because of some embarrassment. That is when it becomes a pathology, right? Now, what about schizotypal personality disorder? Schizotypal personality, they are the ones that are just, they just have this magical thinking, and they're looking at that curtain as, okay, that curtain can turn into a wind, all those kind of magical thoughts. Cluster B is the dramatic. When you think about cluster B, start thinking about our celebrities, for example. Look, antisocial PD, that's what they look like. Can be really, really agitated, aggressive, and it's insane. These are real, this is real stuff right there. Don't forget, I told you earlier that it is a conduct disorder in a child that will lead to antisocial. So even as a child, I can look at a child and imagine the personality if a parent doesn't do something fast before they turn into antisocial. In fact, that conduct is already late. When the kid is already showing all this attitude as an ODD, they are defiant, they won't listen, that is when to go into some serious parenting skills before they convert into antisocial and they become so hard to bend. What about borderline? Excuse my typo there. Borderline, again, this guy, I don't know if you know him or not. He happened to be Kim Kardashian's ex's, maybe boyfriend. I don't know what they were doing, but anyway, they were together for some time. And of course, I remember when he actually met Kenya, he already tattooed Kenya all over his arm. I know this guy had to be borderline. Lo and behold, I checked the internet, he actually has borderline. They can be emotionally reactive. And don't get me wrong too, these things might be natural for them, but then same thing, the chronicity of it is what makes it a disorder. So for that reason, because of that emotional reactivity, there is actually a way we deal with it in mental health. We deal with it through, DBT. It's just a therapy that you try to help them to keep their emotions calm or at bay. Now, this Amber Heard, Virginia, Maryland, DC, we're all in the circle together, right? So many people were familiar with these cases. For me, I'm always shopping around for diagnosis, okay? So I'm very much familiar with her case. And she happened to have comorbid condition. And that's one question people ask me. Is it possible to have more than two personalities? Yeah, it is possible to have three personalities, okay? It's possible to have comorbid conditions together. So in our case, the court record showed that she might be histrionic or borderline. Don't forget, I said earlier that histrionic, they are the ones that, they just want, just see them as attention seekers. You know what I'm saying? Very, very dramatic in some sense. And borderline, of course, emotionally reactive. That is who they are. Narcissistic, many men happen to be narcissistic. I feel like I need to have a different session where I can just talk about narcissism. Narcissism alone would take me an hour to talk about, because many people have this misconception that everybody that acts in certain ways are narcissists. No, there must be criteria that must be met. According to the DSM diagnosis, according to the DSM-5 diagnosis book, it's a Bible, it's kind of a book that we go by. We just don't guesstimate and diagnose people. And narcissism, we always connect it with men. It is not only men that are narcissists. We also have women narcissists. In fact, it is not only women that are borderline. We also have men that are borderline. In fact, male borderline patients are worse than female borderline patients, okay? But they exist. So who is a narcissist? They are egoistic. They think they know it all. They think they are perfect. They will hate your guts to death. They will shove you down in the gutter, but they want you to run to them and embrace them and love on them. Can you see how crazy that is? That tells you it's a big psychopathology. You mess with these people, you are going down. Because guess what? They will not back off until they see evil happen to you. Cluster C. Cluster C talks about, it's pretty much to capture the entire symptom of cluster C is the anxious or fearful type. Always freaking out. I'm running out of time here. I'm going to put 2 more minutes and I'll be done so I can give room for questions. So one of the cluster C is going to be avoidance, right? Avoidant personality. This guy is, nice looking and everything. He doesn't mind being with people, but his ego will not let him. Why? Because that girl at the behind him said, I'm just making up the story, by the way. The girl behind him said something to him in the past, and it hurt him so bad. It bruised his ego so bad. It feels like, you know what? I'm just going to dump all of them. I'm not going to talk to anybody. And that's why he's alone. That is an avoidant. He doesn't want to be alone, but he was like, you know what? I'd rather be alone than to be insulted. And that's the people I say, so if you're going to be like that, if you know you're like that, I'm sorry, don't get married, because you will be insulted in your marriage, and you can't be abandoning your family because of an insult. Now, dependent personality. Look at that kid, so cute. Dependent does not look like this, by the way, but this picture, I couldn't just let go of it. So, but really, as an adult, or I don't know, whoever it is, they can really hang around your feet. When they breathe, can I breathe? They're gonna hang on you for everything. Those are dependents. It's just what the word says. The obsessive compulsive personality disorder, I told you, it's all different from obsessive compulsive disorder. Don't forget, there are 2 components to this, as a matter of fact. Obsessive is is actually the thought is in your head, right? Compulsive is to carry out. So C for carry out. So to be obsessed is I need to wash my hands. I'm thinking about it. Now, compulsive part of it would be I am going to take myself to the sink and actually wash my hand. Now, you are washing your hands many, many times. You're doing all this many, many times, right? And that is OCPD. So that now ends my content. Let me now quickly relate this to life and bring it to life in 5 minutes max. So imagine in relationships, let me just take one good scenario. In relationship, you decide to, maybe you happen to marry somebody with obsessive compulsive personality disorder. And here you are. She's a neat freak. She is always perfect. She has to be on time. Her work is stellar, good looking and everything. You know what these people will expect? They expect it to be the same way. And if you marry this person or if you are friends with this person, you happen to have like ADD or ADHD, whatever you have, you just are so scattered. Can you see how conflict can happen because of that? Because there's no way, she will never see your side. And you will not be able to live up to that side of things that, okay, I can't possibly do this. You see, that is the dispute. That is how the conflict begins. Those are things we don't see. And then all those small things will begin to tear things apart. Or for example, now, look at this person, avoidant. You are in relationship, girlfriend, boyfriend, marriage, whatever it is, with this kind of a person. Your tone is heavy duty. You know what I mean? Every time you talk, it feels you insulting. Or every time maybe it's the women. It could be anybody, by the way. We try to genderize all this. We try to let me say the word genderize things a lot. It is not about gender. Anybody can adopt this personality. Anybody can be like this. It doesn't have to be a man or woman. Does it make sense? So let me say this is a woman, and then, why is she married? She shouldn't be married if she knows that a little insult will get to her to the point that she's going to have to ignore everybody in her life. Can you see that's a problem? Let's talk about schizoid. Now, when you marry or when you are in friendship with somebody, you happen to have a roommate, you don't know she's schizoid. You have a roommate in college, you don't know she's schizoid. Now you have your mom and dad coming down every weekend. She's going crazy. She doesn't want it. You don't get her because you're not in her head, you're not in her world. And she doesn't get you. That why the heck would she not just be by herself and have a quiet weekend? Why do they have to come visit her every weekend? I don't like people around. You will just see her walk out on you. That's what you're going to see. Because she cannot take that crowd. She is not built like that. Now, she doesn't mean to be mean, but it's just nice to know who we are as people. This way, we can find a way to mitigate things so it doesn't affect the people in our life terribly. Nobody's perfect. Nobody, not a single soul. And honestly, I can be schizoid. I have been schizoid before on my unit as a nurse. I used to work as a floater. They float me from one unit to the next. I get to unit A, I'm laughing and joking. They take me to unit B. They dumped on me. Guess what? I'm going to be so like, are you kidding me? That is my that's my way of showing my anger. That's different. I get out of the unit that same morning. I go down, gang with my friends, talk about it, and boom, we're done. And we're moving on. So I'm back to my normal self again. I recruited what? Schizoid for just 12-hour shift. That is different. But now, schizoid permanently and no changes, and that's just the way you are. People come to visit your friend in the dormitory or somebody, or you just don't want anybody. Then it looks like you just don't want anybody. That's just the way they are. But then if you are like that, can you just at least recognize that you are like this and be once in a while accommodating, even if you have to make it until you fake it. So people around you will not be die. Will not be dead until they die, right? I forget how they say that word. But anyway, our behaviors our personality can sometimes be very smothering, and we don't realize it. Very smothering. Let's talk about schizotype too. Every time you see somebody, calm, I see a vision. Look at that hair sticking out. I see this. You might be schizotypal and you don't recognize it. It's not all a vision. I'm sorry. It's not all a vision. Stop freaking people out. Sometimes you need to just keep it to yourself and stop interpreting things the way you see it. In fact, you might be delusional too. Meanwhile, you have to recognize that. But if you don't, you would think in your mind it is good. But to the real world, it is not. You are schizotypal, or you are one of the schizos that is delusional. I'm going to end it right here. I can keep talking all night. I really hope you enjoy the talk tonight. To my students that are here, thank you so much for coming. I appreciate you honoring the invite. And Dr. O is warm enough to say, hey, you're free and welcome to come every Monday. Just have to stand by after this session, and she will connect you, or she will give you a contact or whatever number she wants you to reach her on. But this is an amazing platform. And thanks so much again for inviting me. I muted everybody. I'm going to unmute everybody now. I'm sorry. Thanks for giving me that power, Dr. O. So now I'm done. Anybody have any questions? I didn't give all life scenarios, but I hope you get the message that our personalities actually drive our relationships. But we wouldn't know unless we understand it. Thank you.
Thank you so much. I appreciate you so much. Oh my gosh. Thank you. That was powerful. In how many minutes? I've never seen personality disorder presented, so succinctly in such a short period of time and with such clarity. Amazing. You are indeed who we know you are. Thank you. Thank you so much. So if you put these slides down, that'll be great, so that we can see more of our viewers, and I can see the hands when they raise it. Thank you. So I'm seeing comments in the chat box, thanking you, saying how awesome you are and how amazing you are. It's awesome, Dr. K. This is fantastic. So personality disorder, everyone has something. I like the fact that you made an example of, being, it's an hypothetical situation you talked about being on the floor and having issues, and having this schizo personality for 12 hours. Talk about it and move on. That is not a problem. The problem is when it goes on and on, correct?
Correct. Chronicity of it is the problem.
Is the problem. Everybody has something. You have days, so we call it good days or bad days, correct? Waking up from the right side or the wrong side of the bed is what people will call it, but it is something. So being more, definitive in this, what do we do when we know someone close to us, or even just someone we work with that has one of these personality disorders? For instance, I want to pick the narcissistic disorder because I have encountered some of those, and oh my gosh, they're not fun to be around, or the histrionics. So the narcissistic people, how do you handle it? How can one, first of all, handle, and how can one get help for people who are like this? Or if we identify ourselves as having any of these personality disorders, as you've presented it, what's the next step?
Yeah, so the next step is, first of all, you recognize it. That's a big step right there. You recognize, and you not only recognize, you acknowledge that you have a problem. That is a major step right there. That is a major step to change, not to change it completely, but that awareness will now help you to be a better person. But many of these personalities, they don't even accept that they have a problem. They believe they are perfect, especially the OCPD and the narcissist. They tend to believe in the way they are. So the narcissist, how do I, if I encounter such a person, first I'm going to prove them wrong by being the best I am, because they like to put down a lot. I will be the best person I am. I will make sure I prove them wrong. And then I will make sure I don't fall for their trap of trying to put me down. I will make sure I put them in their spot whenever necessary in a nice, professional way. Definitely, you cannot give in to their put downs, because they do that a lot.
Okay. Thank you. The big thing there is they don't even know they have a problem. They always right. So Dr. Akitonde said, thanks for a wonderful presentation. And he wants to know if excessive tidiness is a red flag in terms of OCD, obsessive compulsive disorder. He also asked what other behaviors can one look out for?
Excellent. And that's a really beautiful question right there. So first, the OCD, OCPD, two different things.
Okay, now define those for us,
So
please.
now, OCD is obsessive compulsive disorder. Those ones, they are ego dystonic. They have a problem. They dislike being that way. The compulsion and the obsessive part is the same. They don't believe in washing their hands 40 times a day, but they cannot help it, but they hate it. And they will do anything to free themselves from that. So they will most likely seek care. So those people, they are better than people with OCPD because they will acknowledge that they have a problem. Anyone, no matter how bad they are, if they acknowledge they have a problem, I will take them any day, anytime. Because now and they acknowledge that it's beyond their control, that means they are willing to really change. Then those ones, you can work with them and help them and guide them through what they need to do. Now, OCPD, on the other hand, they are ego syntonic. They believe their ways are excellent. They believe, the way they wash their hands 40 times a minute, that's what you should be doing too. They believe they're the ones that will even justify and say cleanliness is next to godliness, even though it does not exist in the Bible. They will find a way to support their point. They will find a way to even put you down. You're dirty, you're this, you're that. Excess things, another things. So now, that's OCD, I'm done with that. There are normal people except for that part. The OCPD will now take theirs to another level. They are the ones that time is the order of the day. You cannot be late to anything, they have the best attributes. That's the worst part. That is why they are hard to diagnose. Those are the people that we tend to fall for. Those are the people that anybody will pray for. They are very religious, highly spiritual. Seriously, one of the best traits of it, common traits. And then they have an underlying narcissism. It overlaps with narcissism, OCPD in particular. So OCPD is not OCD. OCPD people are ridiculous. So they need help. But once they acknowledge that they have a problem and they seek help, they can be a better person. Thank you.
Wow. Thank you for that differentiation. That is deep. And we do see that a lot in the religious settings.
Correct.
Okay, can you touch on histrionic? I have dealt with some histrionic people. Histrionic patients are difficult, when you have them as patients also. What would you say to us about that?
I think borderline is actually what people find the most difficult. Borderline is one of the worst personalities out there because they're emotionally reactive. However, going back to your question, histrionics are, for example, Lady Gaga. Histrionics are, for example, Cardi B. Look at me, attention seekers. They want everybody to see them. They want to wear a lingerie to the red carpet. Lady Gaga want to wear the pink dress and enter a tiny door with that wingy looking like dress. They just want the attention. So histrionics kind of sometimes will overlap with borderline too. And dealing with them is just setting limits for them. It's going to be something to help. Because truly, any interaction with them, they can misinterpret to, you're in love with me. You are in New York City, you open the door for them. Oh, wow, you opened the door for me. Oh, she's in love with me. So all those, you got to set that limit, you got to set that boundary so that they will not take that, oh, she's in love with me too, oh, I like your hair. And then they start pulling your hair too, and they start getting close as a provider. That would be the way to deal with them, limit setting. Thank you.
So you talked about borderline though.
Correct.
Can you expatiate that then? Because you said that is even more important.
It's actually intense. It's actually really intense. And borderline, the person that actually came up with the treatment, Marsha Linehan, she's actually still on YouTube. She happened to have borderline herself, so she came up with the treatments to actually help people. What exactly are they about? They are emotionally reactive. They are the ones that will call you in the middle of the night as a provider. I'm going to kill myself. Well, whether they're going to kill themselves or not, you're freaking out. They want to commit, and usually they don't commit the suicide, but they walk you up. And then in your session with them, you can't get anything done except for emotional stuff. That's what they are focused on. And don't get me wrong, we all have our emotional moments, but I'm saying this is like constant. And they split people. They use splitting. You have your staff in the office now. They come in. Nurse A check them in on Monday. Nurse B check them in on Tuesday. On Tuesday, they're talking about nurse A to nurse B. And then on Wednesday, they come again, they're talking about nurse B to nurse A. And then they create so much friction among your staff. They can even cause so much friction among you and your what you didn't say, they're going to say, you say it, or they misinterpret it because they are emotionally reactive. There's something that does to them in some way. So borderline can be really tough to deal with in that sense.
Thank you so much. Dr. Ilukpeju, sir, good evening, sir. Dr. Ilukpeju said, nice lecture indeed. He said, doesn't everyone have a personality disorder, but in varying degrees? Is it not possible that if you think that I have a personality disorder, that I may think that you have, that I may think that you have one too? Is it not that some can hide or manage their personality disorders so that people won't call them crazy? Please comment.
Thank you.
So basically that everybody has some personality disorder. And, I think he's talking about gaslighting here, where, and if somebody is on the forum that don't know what gaslighting is I'm doing something, I'm the one that is doing this, exhibiting this behavior, but then I'm putting it on you.
Correct.
And in a way that is so believable that you would actually believe that you are the culprit, that you are the bad person in that relationship doing that, whereas the reverse is true. That's gaslighting. So that being said, I think it's talking about gaslighting here, where, everybody has some type of personality disorder, and one person may be putting one on the other. But then he has this question that is also very important. Is it not that some hide it or manage the personality disorders? Is it possible to hide personality disorders? Is what I wanted to touch on. Can you hide it? Because you get it? Okay.
I got it. Yeah, I was reading. So you know what? I'm going to get started by talking about something we call intimate partner violence. Is a concept, IPV. Intimate partner violence, IPV. It doesn't have to be intimate partner violence. It could be intimate anybody violence. The people that live in the same house with you, they know you. That's all I can say. They know you. You can hide it from the world though. And coincidentally, people with personality disorders, people outside see them as good. The only people that know them are the people that have encountered them and can, in fact, you that don't have anything, you are the one that they are seen as a problem because people don't know them, because you will never see them, never. Outside, no, you will not. In fact, that's one of the traits of OCPD, obsessive compulsive personality disorder. Don't forget, apart from personality disorder too, we also have other psychopathologies like anxiety, like depression, like people with bipolar. And they can also have underlying personality disorders too. In that case, you really can't hide it. If you're anxious, you can't hide it. If you're depressed, you can't hide it. And then the personality disorder may even make things come out even more obvious. So there is a limit to which you can hide this. It depends. If you have an underlying psychopathology with it, schizophrenia, anxiety, depression, bipolar, or no, you cannot hide your personality disorder. However, if that personality disorder is the only one you have, at least the bad ones, you can really hide it. Like the other ones, the histrionics, borderline, there's no way they can hide those ones anyways. They will come out. Narcissism, you cannot hide it. The main one that is still very hard to diagnose, that in fact, people would think you're crazy if you diagnose them, is still the OCPD, the obsessive compulsive personality. They are everything, okay? They look good, they look right, they do things right. They're extremely clean, they're extremely organized. And they go crazy when they see someone that is disorganized. But when you take that alone and hold on to it, it's got a lot of components to it. So absolutely, you cannot always hide from your family members. And you cannot hide forever too. And the worst thing is this, all this is connected to the neural circuits in the brain, right? The older we get, the more the brain gets worn out too. The neurons get worn out too. So these personalities actually get worse. This explains the reasons for divorce in later years. I'm not trying to justify things. I'm just saying, don't be shocked when people divorce 20, 30, 40 years later in life. Apart from other issues, this is also part of the issue, the problem. That psychopathology gets more pronounced the older they get. That's why you wonder, why can't you leave this? You've done this all your life. I thought you would change. No, there's no change. It's going to get worse for the most part. Spirituality aside.
Okay. I have some more questions, but before I ask, I just want to clarify something. So personality disorders, these people don't even realize they have, they believe this is the right thing.
They believe this is the right thing. And in fact, you can't just open your mouth and say, oh, you have a disorder. Oh, no, it's a big deal. You might break that, therapeutic alliance right there. You have to find a way to slowly let them see that they have a problem, doing some worksheets or something, because they don't see that they have a problem. Yeah, they don't. They rather be diagnosed with a stroke or a heart disease than to say they have a psych problem.
So what Dr. Ilukeju was saying here, though, is that is it not true that some can hide or manage their personality disorders so that people won't call them crazy?
Temporarily.
Is that possible? Temporarily.
Oh, it's very possible. Temporarily.
Yeah.
Temporarily, because those people too, they have gone through life. They know what people complain about. They know. So they will try to find a way to tame it. Does it make sense?
It does.
Just like a woman that goes out looking all cute, but the bedroom is full of clothes on the floor and the bed, kind of a thing.
Hey.
They're going to hide it. You can cover it up, right?
Yeah,
but it doesn't.
I'm so sorry to jump in.
No,
but
go ahead.
but don't everybody complain about each other somehow?
Correct.
Isn't two sides to a story, to a coin in a marriage where the wife says, oh, my husband is like this and this and this, and then the husband says, my wife is this and this and this, and they cannot have a middle ground. Oh, my husband is so bad, he's so crazy, he does it, and then the husband said the same time about the wife. I understand what you're saying, though, that about the extreme, cases of personality disorders is what we're talking about. But what I'm saying is, you can see me one way and I can see you the other way.
Absolutely. Absolutely. And I totally agree with that. And as the workshop I'm having now, actually, I'm talking with couples. When couples have problem and is so deep, I still believe it is rooted in some kind of psychopathology that they are yet to discover. And everybody has got something. I don't care what the gravity is, whether deep or light or on the surface, it is still a problem. That problem can manifest to the person receiving it as something huge. So if a wife is complaining about the husband and the husband complaining about the wife, honestly, there's something going on. Honestly, there is. I have seen relationships that I see that the husband and wife have so much conflict. It is beyond, this person is, how they say this one is negative and positive, or what do we call it? We always say, okay, opposite attract. No, it's not about opposites, beyond opposite attract. It is, if we look deeper, it is probably because the wife is probably ADD or ADHD and can't remember that they have a wedding anniversary coming up. And truly, she just didn't remember because she can't remember. It's like because she's already altered. That's the way the brain anatomy is. Or the husband that now is a perfectionist and believes that everything has to be right. Why won't she remember? Why is she so scattered? Can you see how both ways can be a problem? Well, he comes raging at her. And she's now thinking, he is crazy. Are you kidding me? Why does he have to go off just for that? She won't see it and he won't say it. The only way they will see it is to understand the pathology behind it. There is a disease behind it that they are not saying. I know people don't want to hear disease. People don't want to agree with disease. I believe in mental health.
Yeah.
So
a lot of our COVID patients died because of mental health. A lot of them, they had a bad anxiety and they were treating cardiac or they were treating respiratory. but it was anxiety that should have been treated. So I'm saying it's deeper than we see. It's deeper than we see. And I can't wait to even have, it goes as deep as, it's so sad that we don't have time. It goes as deep as kids suffering in relationships. It goes that deep. For example, I have a father that happened to be a perfectionist, OCPD. And now that father expects so much out of me. By the time I get old, I would think I'm not enough. I would think I'm not adequate. I'll be messed up psychologically because of my father's psychopathology. So what does that tell me? We need to actually take mental health into elementary schools. Hey, if your father acts like this, he's crazy. You are good the way you are. If your mother acts like this, she's very crazy. Because if you see this, you shun it and move on because you are good the way you are. So we can raise good kids in future. Psychiatric and mental health and psychopathologies exist. A relationship with too much conflict, even mother to child conflict, there are differences. It's not only the way they talk to themselves. It's not on the surface. It's something deeper than that. So with a couple too, it's something deeper than that. They both have a psychopathology that they have not figured out yet. If they go to a nice therapy and that therapy knows how to diagnose and they know their DSM, they will figure it out. I'm like, okay, your husband is like this. He didn't create himself. These are signs you're going to see once in a while. Try and, be calm when you see it and talk about it later. This is your wife. Maybe she has bipolar. These are things you're going to see once in a while. This is your wife. She has ADHD. These are things you're going to see once in a while. If she forgets your anniversary, don't take it too personal. She's not taking you for granted. If she forgets to bring you something, if she forget her car keys, if she's always late to church, she doesn't mean it. She just can't get herself organized. She has a psychopathology. Seeing those things is the way to move forward, in a way, for those that want to see it. Thank you.
But there's a key component there. I think what I heard over and over again is identifying the issues in these relationships, especially husband and wife. Right, Dr. Idukweju, that's what she's saying, identifying it. But after identifying, yes, psychotherapy is important, talking to counselor, but treatment also. It's very important that we embrace the fact that there is mental health issues in our communities also that needs to be dealt with. The stigma against mental health is a problem amongst people of color. And I pray that as we continue to, share this knowledge of Medical Mondays, that will change in our communities. Like you talked about bipolar disorder, there's treatment. So that even, it's not a once in a while thing. Sometimes they are depressed, really depressed, and that's not a good place to be. And sometimes they have mania, So there's this flipping, but there's medication that will stabilize, so that the relationship will be fantastic, coupled with therapy, of course, counseling. Talking about this OCD, there's medication that we use to treat. There are anxiety, there's medication.
So, Dr. O, I'm going to just say one thing quick. But does this explain the 50% divorce rate? These personality disorders, or the other things causing this so much disharmony in our homes, where half of the marriages don't survive?
Excellent question.
That's a lot of people. That's a lot of situations there.
Excellent question. And I'm going to defer because I don't know. I've not looked into the numbers. I'm going to defer to Dr. Elisha. Do you know if this accounts for 50% at least of divorce cases?
Oh, yeah, it's actually that high. It is still going back to the science. It's going back to the science of that person with a personality. Let me say somebody with a border OCD or whatever, they don't like to be controlled. OCPD or narcissistic, they don't like to be controlled. So now they marry someone that is controlling. That is friction right there. You know what I mean? Like my own self, if I cannot absorb that, it is nature for me, right? If you can't meet me where I am, I'm not going to meet you where you are. That is the beginning of friction right there. So definitely it's part of it. It's part of it plus some other condition, situation too. The society is probably part of it too.
Mm.
And abuse is not overrated. Abuse is real. And many people just don't recognize abuse. Abuse is also personality issues too. Let's think about it. Think of a narcissist. If you ever deal with a narcissist, there is a way they talk to people. There is a way they look at people. Human beings is nothing to them. They don't see it. Personally, if you get close to them, to their kids, they're good to, but then their kids they probably show them a little bit of it too, or they probably just put it up with it because they have nowhere to run to. But it is part of it. They can be really abusive. Those personality disorders can turn into abuse and they don't realize it. Sometimes it's conscious, sometimes it's unconscious, and then the other person will begin to fight back. So it's kind of all multifactorial. It is not one thing. Because don't forget, we have social in the social. We have, psychologically with this. We have spirituality with this. Everything kind of combines together. So it's like multifactorial, creating that relationship issues. But honestly, abuse and taking each other for granted is still one of the top leading cause. And again, what you see depends on who you are. You don't see things, if you don't see things if you see things your way alone, it doesn't get anybody anywhere. Yeah. But if you try to dialogue, if you know how to dialogue or you learn it because you're in a therapy session, then life gets better that way. So that's kind of what I have to say to that. There's a lot more with that depression, with that divorce rate, a lot more.
Thank you. So Auntie Tower, you have your hand raised now for a while. Thank you for your patience. You can ask. Thank you, ma'am.
Good evening, everyone.
Good evening,
This is a wonderful topic. I need to hear this at this time to make my sanity. This is horrible. Some people just take things for granted. They don't know that human being are human being. You can't use people and dump them. You can't say because you are this kind of personality, then you just go around doing it to everybody. One day it's going to come back to you because what goes around comes around. You don't do that. And talking about many personalities, I know there's Eve, Whitey, Blackie, Pink. Can they pile up? Can they have more than 5, 6, 7, and they show up in different times? And you say, oh, so you are this, oh, you are that. Just showing up like, who is this? I don't think I know this person. I thought I know them. But no, you don't. Then you start learning, and you start studying them, and you start, oh, is this you? You are fake. Fake people. And they have all these fake things around them, but they have this aroma of grandeur, delusional of grandeur, and this and that, and this ego. I can put big something on, and they think that is what makes life. No, it's not. You can wear the mask, and somebody can wear and cry. I mean, some people are just horrible, terrible, egocentric people. How do you deal with that kind of people?
So egocentric people, if you're don't lose yourself ever in life. That's what I tell people. Don't ever lose yourself to anybody for any reason. If you get thrown in the dump so many times, find a way to rise.
Oh, yeah.
Find a way to rise. Once you rise strong and learn from it. But that anybody will satisfy anybody in this world is a lie. It's a lie. A lot of things that we see outside is a little bit flashy too. I think everybody goes through about the same thing. Some people are just able to cover it up. Some people are able to put a smile on their face. That is the difference. But when we talk about people with so much ego, with heavy duty ego, I am sorry. I am one of the people, I don't know how to massage ego. I say things the way it is. You don't have to take it, but don't kill me for saying the truth because I'm going to say it the way it is. Now, they say to massage ego. I think people that sit down there and say they are massaging ego, they are the ones that end up getting killed by the same person. So my point is, if that is the case, there's nothing wrong with communication. However you can get it out. Communication, and don't ever lose yourself. That is the only way. That's the main way. That's the only, because you can't change them. No. The main way is to focus on yourself. Get the words out, let them see where you're hurting, and don't lose yourself in the process, because you can lose yourself in the process if you let them. Because some people get so heated emotionally, they forget who they are. It happens, it's still happening. And I know people that it happens to also. So it's a tough place to be. But again, you can't lose yourself in the process. That's the best way. And if it gets down to a point that you absolutely cannot take it anymore, and it's too much, and it's really, really wearing your life out, honestly, I don't ever say, I'm never going to, I don't tell people to stay in a place and die in it. But I would say you have to step aside a little bit for the hair to cool. Sometimes we step aside also for people to see. And once you step aside, they see it and they reflect on whatever they've done to you, and then things begin to get better.
Thank you.
Thank you.
Thank you so much.
You're welcome.
Prince, Dr. Ajagwesa, kindly unmute and ask your question. Prime children.
Well, thank you
Prime
so
child
much.
born.
Thank you so much for your presentation. Very illuminating. I just wanted to ask, about passive aggression and codependency. How do these apply to the presentations that you made today?
It's still personality. So passive aggression also comes with personality, especially even borderline can be passively aggressive too. They will find a way to just get you down there, and with their words, with their actions, with their emotions, they will find a way to get you down because they're down. So with our OCPD also, narcissism also, it still falls on personalities. That's pretty much what I have to say. But if you have a specific scenario, help me out here so I can relate it and connect that together with it.
Yeah, well, the way I'm looking at it is that there are people, they play the ostrich.
Like Dr. Who was saying.
Is they put their head in the sand and pretending not to see what is going on, but actually not admitting that there is any problem with them. So they look for other people to blame rather than accepting what it is their own problem. They are constantly looking for other people to blame. So, I'm just kind of trying to understand it. Is that a form of passive aggression, or just blaming in order for them to look better than other people?
No, we in our own eyes, we are all perfect. Okay. They might not be doing it deliberately. Honestly, in our own eyes, we are perfect. I'm right, you're right. Mm-hmm. I'm not wrong, you are not wrong. In our own eyes, that's the way it is. So whoever is passing blames, or as long as it may look like passive aggression, it might not be passive aggression. It might truly be what they are feeling or what they are seeing, or misinterpretation of that situation too, which may fall under another delusion too. We have a condition. We have types of psychosis. Delusion is one of them. We have types of delusions. That they always see that, my husband is cheating on me, my wife is cheating on me. It is a condition. That?
Yes.
It is a condition. And
right.
In that situation, where are we going to put that? And now people that are they are believing that you're cheating. Meanwhile, they are seeing things. But they will still be wearing normal clothes like you and I. So this is where, mental health becomes really deep and murky. When you talk about codependency is just meaning that you're trying to survive a relationship, even in the midst of abuse. Like you're trying to still hang on and hang on and hang on. That may be a pathology that fits into what? Dependent personality disorder. In fact, dependent personality disorder, once they leave one relationship, they're jumping into the next one. They can almost not stand alone. That is just what they are. That is just, so it's all, if we look at the big picture of personality, it's going to tie into personality disorders, but it might be other things too, though. It might be other factors. What was their childhood? What was their childhood like? What kind of attachment did they have? Did they have a mom or dad, or they were never even emotionally connected to anybody? Now they are craving for one. So this can all come in play. This can all fall into that picture. So it's a bigger picture there, unless that's why a scenario must be played place completely before one sees a big picture.
Thank you. Thank you very
much. I hope that helps. You're welcome.
Thank you so much.
You're
So
welcome.
my sister, Tina, kindly unmute and ask your question. There you go.
Yes, good afternoon, my sister.
Welcome, welcome.
Thank you so much. So I've been listening to what was being discussed, and I really appreciate your invitation and also that I joined. I just have a question in regards to narcissist. One thing that I do have experience where I had a friend that is a narcissist. So from experience, the narcissist, they don't have emotions, meaning you could be crying in front of them and stuff like that, and they still don't even realize that you are hurting. So is that different from the other mental health issues that the doctor brought up? So that's my question.
Yeah, so to be honest, personalities do overlap.
Okay.
Narcissism is pretty deep. Okay.
Right.
Dr. Ho, will you permit me to quickly read out the main, I will read the OCPD and narcissism.
Yes.
And
Please
that's
go
why
ahead.
okay, thank you. My next YouTube video, I'm actually planning to actually make it clear to people that, hey, these two things are different, because people think that they are the same thing. I mean, that everything is narcissism. So look at this one quickly. Let's look at narcissism. Okay. Permit me to just read from here, okay? Sorry. So, and I will tell you also, while I'm pulling this up, narcissism is not only men. We look at men a lot about narcissism. Some women are also narcissists. But the very high percentage of men are narcissists. Does it make sense? That is the difference. Then we can also have somebody with histrionic and still be a narcissist. We can have somebody with OCPD and still be a narcissist. It can overlap. Does it make sense? So look, who is a narcissist? Somebody that have grandiose sense of self-importance. Somebody that is preoccupied with fantasies of power, success, brilliance, and beauty. Somebody that have belief of self-importance and belief special and unique, excessive admiration required. Somebody that is that have unreasonable expectations. You just punch me in the face and you want me to come and give you a nice little hug. Somebody that lacks empathy, like you just said. Even when somebody's falling apart in front of them, they can't see it. As some pregnant women, they will call me and say, can you believe it? I'm struggling here to put on my socks. My husband didn't even see it. I'm thinking, did you ask him? Because I promise you right now, he's not seeing it. Somebody will say, I've been crying all night. He didn't even come to my head. I said, you want to hear the truth? He doesn't see you. He's not seeing it. You can't see it. So that is that people, they just lack empathy. That is why they are able to mock anybody. They're able to talk to someone that cannot walk. They envy others and believe that others envy them too. When you are progressing, they cannot handle it. Okay, let's go ahead and talk about the other one, which I say is very, very close. And that would be the OCPD. Let's look at OCPD quickly. See, they are preoccupied with details, rules, and organization. They are perfectionists, right? They are overly conscious of it. They are very, very inflexible on issues of morality. That's where the religious comes in. They have orders. They like to keep worthless objects, whether it's useful or not, they will just hold on to it. They are reluctant to delegate. They adopt miserly spending style. They do not let go of a dime, even if the world is falling apart. They are rigid and stubborn. That one comes in play with, if you offend this group of personality, OCPD, you know what's going to happen? They won't act like they see you. You don't exist in their world. You know. They will find a way to make sure that this rigidity just works for them. They will do everything to ignore you. And of course, you know its classic sign, miserly spending. So how is that very different from narcissism? Not too different. Narcissism is the worst one, but then by the time the OCPD comes in action to and display their real self, it overlaps with this a lot, because the self-importance and being special and unique comes with excessive dressing too, right? admiration. So they tend to overlap a lot, those two things. So what am I saying is, you can't conclude that they are narcissists unless they have been like that consistently. Are they going through something at that moment? You know what I'm saying? And they're just being mean temporarily, or they are always like this for 365 days in a year. That's a problem. Then they are narcissists. And if they truly, truly lack empathy, yes, classic sign, narcissism. Definitely narcissism. Those are the two main ones that lacks empathy. Narcissist, and OCPD. They lack empathy. They really do lack empathy. And they feel so important. And I want you to admire and embrace them. So most likely narcissism. But, other factors will play a role too. I hope that helps.
Thank you.
You're welcome.
Thank you so much. So if you get the slide down, I will be able to.
Sure. No, sorry.
Okay, great. So Ngor, kindly unmute and ask your question. Nice.
Okay. Good
Yeah.
evening, all.
Good evening.
I think this program is for me. This very one is meant for me. Thank you so much. I have learned a lot of things. I want two questions. Everybody in this world, do we have some sort of these medical issues? Because I don't think everybody will be clear of one or two things.
Correct, we do. Everybody does have something.
We do.
And everybody does something, but the degree is different.
Degree. Okay. Okay. I hope this one, if anybody goes on the recorded thing in future, the question and answer time doesn't come up. I'm not very sure, but I have a relative, and it's really giving me a concern. This is somebody that will call me all the time, report his wife. This is what my wife is doing. I'm frustrated. I want to leave. Okay. Can I talk to your wife? No. Don't talk to my wife, because if you talk to my wife, she will say you are reporting me. Then that we go. Then another one is from the same person. Because you are dancing too much. That is why my son is dancing. So don't dance too much. Because whenever you're on the phone, you ask my son to come and say hello to your friends. And I don't think it's nice. Okay. I don't have a job now, and my wife I can't believe my wife is saving. She gave me $2 million, 2 million naira. And I don't know, which means she's been saving. I'm the one who has not been saving. That's that we go. Then another one will come up. Why is she not respecting me? I'm her senior. Yes, I married her, but I'm some few years her senior. Why is she talking to me like that? Will she talk to her brother like that? Will she talk to this like that? Another one will come up. Like, oh my God, when I come back from work, she can't wake up at midnight and give me food. It is just complaints and complaints and complaints. Do this. No, this is what I want to do. I want to do this training. Why don't you do this? Because it's good for you. No, this is what I want to do. How do I manage that? Please.
Okay, so that sounds complex. So that sounds like this guy has a lot of ego issues for sure.
Yes.
And thanks so much for sharing that. And the complaint that he's having though may be valid. So you're saying that when somebody calls and they're talking to the kid, the wife will complain that why are they talking to the kid?
Yeah, no. It's like if I call you as a friend, and I now say, oh, come and say hello to my friend, it becomes a problem.
Who's going to have it as a problem? The wife will see it as a problem.
No, that's my relative.
Okay, the guy that always talk to you, we see it as a problem.
Yeah. Why are you telling him to talk to somebody? Don't tell him, it's not nice. So sometimes I don't even know where to place it. Sometimes, okay, the boy will decide, I want to go to church with you. No. Why are you going to church with her? Just no. Go to church with this person. So I don't know, just sometimes, excuse me, it does my head in, and I'm thinking, am I the one who's mad here or what?
So what is, no, you're not. So first of all, is it like the very controlling type?
I think so. It's very, honest. That's why it's so difficult for me to place. I know it. Sometimes it can be controlling. Sometimes it can be sympathetic, like, oh, I am this. Oh, I am this. It's because I am this. That is why people treat me like this. Honestly, it is a very difficult situation for me. And I've been thinking, how do I handle this? I don't know.
Wow. I think for somebody like that, you have to take it case by case. What is it talking to you about? Are you able to see both sides? And at some point, you have to be honest with him that, hey, if I can't see the opposite, because there's always two sides to a story. How do you know that he's telling you 100%? And if he's telling you don't call this person, don't call that person, there is no way you can make an informed conclusion or informed decision. So in fairness to the other party that she is reporting to, you just have to say, you know what, unless I hear the other side, I wouldn't know what to say. You feel you're going to sympathize or empathize with him. Oh, I'm sorry that you're going through this, but why don't you try something else? Why don't you just make your own just suggestion? If he takes it. But of course, again, I understand now that when you ask him to do things, sometimes it kind of blocks you off. But you still make your own suggestions. Go out of your way to do that without judging the other person because you have not heard the other person's side. That will be my recommendation for that person. And eventually, just don't entertain everything he says all the time. You can't, especially if he's not making any sense to you. You welcome him and everything, but don't entertain it. Unless you entertain it, the more it's going to pull away from you a little bit. Because if you feed on it, you're probably like putting more water on his ego a little bit. It sounds to me like somebody with a lot of ego, and it's going to be tough to handle.
And if I don't entertain it, it's like you don't want to listen to me. You don't want to hear what I'm saying.
No, you won't push it. You won't make it obvious that you're not entertaining it. You will still be therapeutic about it.
Okay.
As you let him start, give him 5 minutes before he starts. Oh, I'm sorry, I'm not trying to rush you, but I'm in the middle of something, but I can listen for 5 minutes in a nice way. So 5 minutes, that's it. So that when he's talking, I'll say, hey, sorry, I gotta go. No, that will not be a nice way of doing things. Before he even starts, I have 5 minutes, I can sacrifice 5 minutes. Do you mind keeping it down? Especially if he's not dying. And if it's a life and death matter, that's different. Then I would definitely give as much time as possible. Or if it's an emotional situation that is truly deep, that's different. But and if you're not the only one seeing this, if someone else is seeing him like you are seeing him, then maybe it's the one with an issue. Maybe it's not the wife. Yeah.
God will help me.
Amen.
That's deep.
Thank you very much. Maybe I need to be reading more about this.
Thank you.
At least when you understand a little bit of him, and I hope you can connect with me. I don't mind breaking that. I would love to hear from we need like more stories about him to figure him out. Anybody can figure it out. Yeah.
So if you private chat her.
I won't mind. I won't mind. It will help me. I won't mind at all.
Yeah. If I tell people, even if you tell me about the way your father is or the way your mother is, I can pretty much anticipate your current, because some things are genetics too. The way we grow up and stuff like that. Yeah.
Thank you.
Thank you very much. God bless you.
Dr. Jagwe, do you have another question, sir?
Yeah, I just wanted to ask her to talk about denial in relation to all that we've been talking about, because it's easy for some people to deny. They feel like anyone who wants to talk to them about what they observe about them is just putting them down or is just finding ways to make them look bad. And rather than the person being receptive, they become so defensive and they become very, abusive in terms of how they respond, because they are already in denial. So if you tell them, well, the way you are behaving, something is wrong, then they say, well, how about you?
Correct.
How are you behaving? So I know you've explained some things about everybody has something, and everybody, if you're talking to somebody, you can say, well, I see what you have. If you see what I have, I may not even know what I have, right? But even when it's obvious and then it's pointed out, there's the likelihood of some people denying and becoming abusive, in order for them to insist that whatever observation you are making is not acceptable to them.
All right. Thank you so much. First of all, what is the root cause of denial, and what does it mean to be in denial? To be in denial means you are looking for ways to actually justify whatever you're doing. You don't see your problem, right? So, and then you want to blame other people for whatever woes you're going through. So the way to deal with people that are usually in denial like that is you acknowledge your problem first, even though they will still push it on you anyway. For example, I'm going to say, you know what? I think I have a little bit of memory problems. I have a little ADHD, and I'm sorry for the way it has affected you in the past, or is still affecting you, right now. But do you mind if I tell you that I'm seeing some of this in you? How do you want us to work about it? And he or she will probably say, oh, what do you mean? Do you think I'm crazy? No, I'm not saying you're crazy, but I'm saying I'm noticing this, and this is kind of what it means. This is it. You want to go read up about it. That's the way I will approach it. Nobody want to ever see that they don't want to be told, especially from where we come from. A little bit of psychopathology that we think is crazy. No, it's not madness. Madness is schizophrenia. No, nobody would be in a good clothes with that. But the rest, a little bit of mental psychopathology is not weary. It's not madness. Sorry, I'm speaking my Yoruba now. It's not madness. So it's not something out of the ordinary to say, hey, oh, I think you have this personality. Go look it up. This kind of fits you. I have my problem too. I will continue to read mine. I think this is mine. I'm telling you right now, this has been my approach to myself. This is my approach to couple. This has been my approach to even my uncle. You have to point your own out first.
Thank you.
Point your own out. Yeah.
Thank you
and
so much.
Hopefully they'll be more receptive. You're welcome.
Thank you. So Dr. Akitonde, also said, because I have some questions in the chat box that I want us to quickly, broach. He said, you've just described a relative of his. That was then when he wrote, said his OCPD, definitely. He was expelled from a church where he was a pastor. The problem is he strongly believes he's operating under Holy Spirit anointing. How can we help him? Oh my gosh. Please, before you answer that, I had an experience with someone, actually was a friend or a friend, junior friend to me. He went through this span where he just became very spiritual. He claims he sees this, he sees that. He started seeing things and stuff like that, and was on the verge of moving out of his home, out of state, away from his wife and children. And, because he was seeing things and he believed that was what he needed to do. And so the wife came to me and said, something's going on. I'm like, So is somebody who respects me, and I engaged him and figured out that he actually has bipolar disorder, and he was in the manic phase. So it wasn't even OCPD, it was bipolar. And so I persuaded him, convinced him. By the way, he's actually a medical doctor.
Correct, they're smart.
Which makes it worse. So I convinced him that, look, let's do this. Thank God you know medicine. I'm starting you on this medication and this medication. And, it takes a good 6 weeks for these things to, get into the fullest working point. So I said, let's wait for like 3 months, see what happens. If I'm wrong, then you know what? It's the Holy Spirit, it's spiritual, and we'll leave it there. It took like 4 weeks, even before then. It's gradual. It was changing. He came back to his norm, even better than he had ever been. So he's had this thing for a long while in the, sort of depressive state, but not enough to incapacitate him. And then he became manic. And he's doing fantastic now. Thank God that he has a wife that was patient, loves him with a passion, knew her husband and knew that, wait a minute, this is something different. This is not him. And by God's grace, we knew each other and came to me. And I'm not claiming that I did something. I thank God that the Lord showed exactly what it was, and we were able to intervene. So somebody like that, I don't know if it's Holy Spirit anointing. I think it needs to get evaluated, and just to make sure that it is not a personality issue, or because bipolar disorder is not a personality issue.
No,
that's
it's a
something different.
issue.
Yes, and to make sure that it's not a personality disorder or mental health disorder like bipolar disorder or even something else. So that's what I'll say to that. Haman is from London, and so figure out what time it is now. He said he really enjoyed the presentation, first time that he had such a breakdown without getting lost in too much medical terms. So kudos, Dr. Elisha. Thank you. He said good examples that one could have and most probably experience some of the personality traits personally or with others. And he asked to share it. But then he went, he asked another question, that what advice can you give on getting someone to discover diagnosis in a culturally sensitive way from the right practitioners? So he asked if he can share this with people on YouTube. Medical Mondays is streamed live on YouTube, and you can watch this episode again and all the past ones. Kindly subscribe, and yes, you can share it with as many people as you want. But what advice would you give in, and being culturally sensitive doing that?
Okay, so to be culturally sensitive means to be aware about other people's culture. So some things, and that's one thing with the diagnosis of statistical manner of mental health disorders, actually, the DSM-5 5th edition says we have to put cultures into perspective before we diagnose. Because that person that is all like this, or the person that's going out and looking like a manic man, maybe that's the way they act, or maybe that's the way they behave maybe that's the way they behave in their culture. So we have to look into all angles. We have to look at all this before we conclude on any of this matter. To be culturally sensitive, though, is to, first of all, you want to maintain some kind of therapeutic alliance with your patient first. You want to make sure that you understand them and they understand you, so that they will not misinterpret everything that you say, because you cannot know every culture, and the way they're going to handle mental health in one culture is not the way they're going to handle it in another culture. So as you present this to them, you want to walk it through it together. Like, hey, I don't know. I know culture. Everybody's culture is different, but I do know there is still right and wrong ways to behave. I'm noticing something, and this is what based on my professional expertise, this is what I noticed. Can we walk through this together? Have a template, walk through it together. Say what the book says. When you have this, you have this. When you do this, you have that. That will clear it out. It's all there. So you are figuring it out together. Even though you are so sure, you play with the puzzle together. You know what I'm saying? After establishing that therapeutic alliance, you walk through it together. And in fact, let them be the one to now conclude and say, oh, this sounds more like me. And that will get you there.
Thank you so much. So, Haman, can you unmute? Because he did raise his hand. It's 1:20 a.m. or 1:23 a.m. now in London. You raised your hand and then you lowered it. Would you like to ask a question? I don't want us to miss it. Haman? Can't find you. Okay, so lots of thank yous. Dr. V from California says thank you, a talented speaker, Dr. Kehinde Elisha.
Thank you.
Job. As usual, great resourceful questions from all. Kudos. And I just wanted to share also. Oh, Haman says, thanks for asking my question, Dr. Oh, okay, thank you. Okay, Haman, you bashful, right? You don't want to talk. That's fine. So also we're streaming on Facebook. Thank you, Dr. and Dr. Ajay. We stream also on Facebook Live. I wanted to mention before we conclude tonight, that Dr. Elisha, actually, if we have NPs, nurse practitioners on the forum, and we do have nurse practitioners on the forum. I know some of them there. And you need a board exam review. She's the person to go to. Our success rate is amazing. So, and I know that's why she has so much following. So please, she's the person to contact. You will see that I reposted that in the chat box, and I'll repost information on how to, contact her. You will see our website there. Okay, for anyone who needs that help. She prepares NPs for boards and they pass. So, Dr. V, you have a question. Go ahead. I think that's the last one we'll take for tonight because Dr. Elisha has to go put the children to bed.
So I'll make it quick. Thank you, Dr. O, and thank you, Mr. Dr. Elisha.
All the way from California.
Oh, goodness. I'm coming for dinner. It's my birthday today. So, Dr. O.
Happy birthday.
Thanks. Dr. Elisha, there's a tendency when we listen to this kind of very factual clarity of presentation, we certainly wear the hat of doctors now. So what of wisdom do you have for us, because we're not doctors like you, to just going out and start breaking down everyone we see and diagnosing them? How do we live here so that we don't dangerously start analyzing everyone we see now and diagnose them and put them in a little bucket? What word of advice? Thank you.
Correct. And that's why I constantly was saying, not every man is a narcissist. Some traits are like that, but women are also narcissists too. And that's because there are so many YouTubers now. They are not even clinicians. They didn't even go to school. Maybe they have a GED maximum. And here they are talking like therapists, talking like they just grab the DSM and just give it whatever meaning that they want to give it. So we have to be aware of that. We have to be conscious of that, because many people don't take that really lightly. So in that situation, if you know you are not the ideal person, you don't want to diagnose your spouse, or you don't want to diagnose your friend or your roommate, you can it's a book. It's written in English. You're going to take that DSM-5 book, look at the traits. It is just characteristic. And Google typically have a good information too. What are the characteristics of this personality? If you already have the knowledge and you know something is not right with your relationship, it is the matter of looking more into it, but try not to slap it on people's face. I have done that and I've gotten my fingers burned in the past. People don't take that lightly, especially Africans. They would think you call them crazy, but it's not crazy. You're not saying they're crazy. It's not crazy. Having a personality does not mean you are crazy. There are still normal people like you and I, but their thought process is a little bit off. That's all it is. You know what I mean? But that is not the same thing as losing your mind. When you lose your mind, that would be something different. That would be called psychosis. So that would be called crazy. So that they are not crazy. So my advice is, if you're very convinced that something is not right, make a recommendation that they need to see a therapist. Make a recommendation. I mean, I don't think it's too much to make a recommendation. Make a recommendation or make a suggestion. Or you can say, let's both go see a therapist and see if that works well, if that plays out well. I've never really seen it go well with many people, especially Africans, because education is where we need to start. Many people are not knowledgeable about mental health. But to those that get it and they really want to save their relationship, they will go to the mental health provider or whatever, the counselor. When they get there, somebody will be able to shed more light, and it won't be just you that is non-professional. But a lot of times when you smell something or when you suspect something is not right, you're probably right. Something is probably not right. We have instinct, and I believe in it. Thank you.
Thank you so much. You know, I wanted to say, I said she has high success rate. Dr. Elisha has some students here tonight, and somebody said she has 100% success rate. And another person said 99.9% success rate. Guess what? 99.9%, 100%. She has 100% success rate when she prepares people for the boards. And I'm going to mention that it's not just the NP board certification. There is the PMHNP FNPs, that's family nurse practitioners, AGNPs, and acute care, all across the board. So the students are so appreciative. Thank you, students, for being here. If you came in later, I did say to you guys that you are our future. And thank you for embarking on this journey, and because you are the ones we're going to hand on the baton to. I'm always excited about the young ones. So thank you. And thank you for attending. Dr. V, happy birthday. You're getting birthday wishes all over. And I don't want to miss any questions. Thank you so very much, everyone, for an amazing Medical Mondays. And thank you, Dr. Elisha.
Thank you for
I'm going
having
to
me.
have you give us a parting word. But before you do that, I want to stress or mention again that we are not establishing physician-patient relationship on this forum. We are sharing knowledge. We are, empowering, and we building our community is what we're doing. If you need assistance with further assistance, reach out to me and I'll link you up with, the appropriate specialist. So over to you, Dr. Elisha, with your parting words. Thank you.
Thank you so much for attending, everybody. And don't forget, relationships are important. Families are important. Understanding and knowing the person that we're dealing with and having a longer relationship is still better than divorcing, or it's still better than walking away and leaving the kids to so much trauma. So let's keep that in mind. And because of the knowledge of that, let's prioritize our learning and make this, take this seriously and learn it regardless of our spirituality. This is also part of what makes us anyways. We will not only help our community, we're also going to help ourselves too. So that those things that are causing distress will be probably minimized or will be reduced. So we have less people having depression, having anxiety because of what they don't know. So knowledge is power. Thank you.
Amen to that. Thank you so much. And have a good night, everyone. Much appreciated. Thank you.
Thank you, Dr.
Thank
O,
you.
Dr. Elisha. We
Dr.
appreciate you.
Elisha. Thank you.